Demosthenes Sarigiannis is going to present us ENVESOME project. Glasses again. Demosthenes, I have to short it because it's very long. I mean, Dennis. It's very long. Dennis is the director and chairman of the board of the National Hellenic Research Foundation. He's also professor of environmental engineering at Aristotle University of Thessaloniki, where he leads the environmental engineering laboratory, the general chemical technical laboratory, and the research group of the exposome and health. He also holds position as associate professor at different institutes and universities, serves as president of the Mediterranean Scientific Association for Environmental Protection, and many other associations. And his research focuses on understanding the human exposome to improve health risk assessment on environmental and industrial toxicants, studying the effects of climate change, and integrating health considerations into circular economy strategies. ENVESOME is a project of 16 partners from Greece, Spain, Austria, Portugal, Poland, Denmark, Germany, and Slovenia. So please, the floor is yours.
Thank you so much, Chris. Thanks. First of all, I'd like to thank Chris and all her team for a great organization before and during so far meeting. This is a great start of working together, and I'm really looking forward to that. I have to say, before we start, and that's not trying to cajole the Commission, but I'd like, personally, because I've been involved in the exposome research since the beginning of the exposome in 2005, and when I still was at the JRC, this is really one of the best written calls, and I think we can see the results in the excellent content and science of these projects. I'm honored. Personally, it's a privilege to be part of you, of this team, and because I've been part in other clusters, in other projects, this probably is the best I've ever been in. So again, congrats to all of you, independent of what we're going to be successful in doing, but the design is perfect. Well, okay, just to be realistic here. Anyway, so, okay, so why the ENVESOME? And one last comment. I thought I was among the people in Europe who put together the largest teams. Most people say this is a really very large consortia. I'm not. You are better. So that's even better. All right. So in terms of the actual scientific challenge, well, I think we all know that over 75% of EU citizens live in cities, exposed to different mixes of stressors from air pollution, noise, light, artificial light, hazardous chemicals, climate change impacts. But of course, you have social determinants of risk, of public health risk in terms of inequalities, inequities that actually amplify these risks. This drives a rise in non-communicable disease. I think the key word here is actually cumulative. I think that's a very important point to highlight. It's not just about mixtures, as current day toxicology is trying to focus on. It's about accumulation of exposures throughout the life course. And I think that's a very different concept than just mixture toxicology. I just want to say this because you have excellent toxicologists in the group, but this goes beyond what we are all trying to do here. So our mission here is to actually create a transformative initiative to bridge science, policy, and society by reducing the health risks from environment, promoting equity in health, and of course driving sustainable change in European cities and beyond. I will not tire you with this, but these are very important data to keep in mind. What we think ENVESOME is unique for, I think first of all an integrated and beyond the state-of-the-art approach, combining human biomonitoring, both targeted and untargeted, in vitro studies and multi-omics integration, on purpose non-in vivo studies. So that's an interesting complementarity to several of these projects presented today, very interesting. And I'm really looking forward to connecting and seeing how we can create a really optimal workflow to do environmental health. System biology and advanced exposure modeling, and of course innovative sensor technologies. We're using a tool that we've already developed, the Integra platform for cumulative and aggregate exposure and risk modeling, agent-based models for exposure assessment to simulate realistic lifetime exposures across different population subgroups. And then we move from biology to impact, implementing what we think is high-dimension biology, multiomics, which actually reveals how exposures actually disrupt pathways. And so the idea is to deliver dose-response data and actually thresholds for biological effects towards new exposure limits and, of course, evidence-based prevention strategies. We're moving towards what I call precision prevention. This is to be tested in urban living labs, so community-scale initiatives to co-create healthier environments. We've done this already in another exposome project on the urban exposome called ENVESOME, very successfully, I believe. Again, I was a coordinator, of course, so I'm completely biased, but still the point is that that's a good approach. So we found it very useful. So co-creation in urban living labs, I suggest to everybody. And of course, the point is to be able to turn data into actionable insights, into action. The translational part of the project is very important in terms of creating real-world solutions with AI decision-based decision support tools for policy making and planning. Intelligent chatbots, trying to look to support the everyday work of healthcare professionals, and also, of course, personalized coaching apps for citizens. We have done so far. We have experience in the first and the third bullet with tools that have been developed in previous projects. We're now working on on the second one as well, because I believe this this system of tools can actually be very helpful in translating in practice the what we are deriving from this complex scheme of science. So this is when I first presented this thing, in 2013 actually. This I called it my personal exposome Guernica, but since we're in Barcelona, we can say that here. But the point is, this is really trying to combine environmental data with a focus on exposure as opposed to just environmental characterization. So looking at sensors, multiple sensors, remote sensing, advanced environmental modeling and data management with advanced exposure modeling using, as I said here, machine learning tools like agent-based models, socio-demographic factor integration, physical activity data with sensors and also exposure data, again with personal sensors, to this system of aggregate exposure modeling, which then you need to translate into what happens in the body. So because none of that is really we usually get there and we are very happy. We've done a great characterization of exposure, but in reality, the effects do not come from this, they come from what's happening in here. So we use in this case a combination of biomonitoring and biosampling and PPPK modeling, physiology-based biokinetic modeling, to address how chemicals and non-chemical stressors actually can be like particles can be distributed into the body at different parts of periods of life. So this is starting from in utero exposure all the way up to end of life. So that's a model that actually is already validated in a number of projects and different populations. And this is a life course model, so it changes, the physiology description changes with the different age groups of the individuals simulated. So this way you can derive internal dose, potentially biologically effective dose, which you can then apply to in vitro models. Here we use MPS, microphysiological systems, organoids, but also 3D cellular models, and a combination of multiomics, and we use the same type of techniques for human data, for human samples. That's the human biosampling part here. So the idea is to derive this multitude of omics data, go through a very advanced, I think, bioinformatics pipeline with advanced system biology modeling included into the bioinformatics to actually start creating essentially joint pathway analysis and identify molecular initiating events, move all the way up to different molecular events that lead to cellular and tissue level effects in this sense, identify early effect markers. I think that's key if we really want to move towards precision prevention, and eventually link all the way up to system-level effects on the individual. That's because, again, I'd like to highlight the fact that, technically speaking, the exposome, even though we usually think about it as a public health tool, environment and health in general, it's an individual exposome. It's my exposome. It's not everybody's exposome. Okay, and what I had for lunch is different to what Nafsika had for lunch, and what I had yesterday for dinner is different. Of course, I have a different age with different pathologies, so how all that will affect me tonight and tomorrow will actually be different. Okay, so let's be aware of that. That's why our approach is indeed an individual-based approach that then we convert into population level with exposome-wide association studies, try to link to community-level effects using our cohorts, and eventually try to get to a risk-based population stratification that can then support decision support making, the coaching that I mentioned for health practitioners, the chatbot, and then, of course, a toolkit for healthy cities, which I think is very important for the impact, all of that. These are the cohorts we have in hand. So they span from Greece, Spain, Portugal, Slovenia, and Poland. All of these data actually are collected right now and the respective biobanked samples. So we're ready to start with the analysis. These are 22 cohorts spread across 6 different countries with a total population of about 17,000 participants. We have a harmonized codebook for that. And this is the actual toolbox. So you see the environmental monitoring and human biomonitoring, the high dimension biology and bioinformatics pipelines, the machine learning and AI-based system biology modeling, and also then the agent-based modeling to combine all of that in terms of enhanced refined exposure assessment supported by personal sensing at the individual level. Here, that's a nice graph I personally like because it actually shows the difference between the actual daily intake dose. This is for UFPs or PM in general. If you take, for a specific case, if you take into account different ways of measuring, because another thing that we have to pay attention to if we're really going to the refined level of the personal exposome is what we measure, how we measure. For instance, here, that's the result you'd get for intake dose of PM 2.5, I think, if we use the normal regulatory monitoring stations in different cities in Europe. Okay, so that's the estimate you get EU-wide. That's the respective daily intake dose. If you take into account indoor concentration, we spend most of our time indoors. This is the green bar, so that's much less. If you take into account personal exposure with personal sensors, it's the it's the black one, the gray one. And if you take into account of the fact that when I'm inhaling the particles that my sensor has captured here, on my lapel, I don't do this. I do this as a function of the intensity of activity that I am undertaking. So right now, actually, I inhale more because I'm speaking, standing up. You get to this blue curve, which is the real biological intake of these ultrafine particles. Okay, so you see how much different that number, that the regulatory estimate is, from that number. Okay, that takes into account all this variability. I'm not saying you can do this for all the population of Europe at the same time, so this number is useful anyway, but it's very important if you do the exposome analysis to actually take stock of that. The additional things, of course, the modeling part, I mentioned the multimedia, multi-pathway, multi-route aggregate and cumulative exposure model. That's Integra, the Integra platform. We also combine with biomonitoring data and manage to reconstruct external exposure from the biomonitoring data. And we use this to actually support exposome-wide association studies. That's an example of the effect of different factors like developmental stage, route of exposure, in this case SNPs, genetic polymorphisms in bisphenol A exposure, and for the same level of external exposure. Again, interesting, significant differences. That's a logarithmic scale, so that is actually a very important difference. We have 2 prospective studies, two intervention actually studies, practically, right, Nafsika? So one is about the urban environment, that's the urban well, and that's an exposome study with interventions that will hopefully innovate solutions on effects of combined chemical and physical stressors in cities, including ultrafines, black carbon, allergens, noise, and light, on different types of health outcomes. I'll tell you later. That's the design of the study, and that's the eco waste. That is for hazardous waste and industrial contamination sites, looking primarily on neurotoxicity, metabolic syndrome, and developmental immunotoxicity in different countries in Europe. The key results we expect to have is, of course, a number of scientific and research outputs, including exposure models, biomarkers, early effect biomarkers, pathway-based insights, adverse outcome pathways, adverse outcome networks, but also data resources like FAIR databases integrating environmental, biomonitoring, and health data. And of course, tools and systems that actually connect all this knowledge with the real world, AI-powered decision support, Healthy Cities Toolkit, and digital health tools. We expect to validate these results in real-world cases in 10 case studies across Europe with a urban living lab approach, to provide through this process guidance and indicators in terms of new pollutant limit values, health impact indicators, and policy guidelines, and of course to create basics for future research and collaboration beyond this cluster and this project work. That is to create robust data sets and pipelines that can be reused in a number of research initiatives beyond the project and even post-project, to have validation of ENVESOME biomarkers by multiple EU institutes. We're in contact with a number of these. And of course, to set the basis for precision prevention in Europe, and not only Europe, but obviously we're focusing on the EU, and looking at exposome-based risk assessment and interdisciplinary collaboration across omics, AI, and I'm very happy I heard about all the tools on AI previously, and of course urban health. The expected impact, both political and societal, has to do with shaping policy and regulation, transforming healthcare and prevention with the early effect markers, for instance, in risk communication, and of course driving societal change with change in lifestyle and exposure reduction, strengthening health equity, and also public awareness. And that's indeed the finally active live ENVESOME website. I was very peculiar about the graphics. That's why it was not on. Everything was there. Okay, thank you so much.